So as I mentioned, my name is Jen. I'm one of the nurses here, and I'm a specially trained nurse. I'm a forensic nurse, and so there's a lot of things that I can do to help you. But first off, I just wanted to hear from you what you're most worried about right now.
Me and my husband have been married for 5 years, and I haven't worked in like 7. So he has control over all of the accounts and all the money, and he only gives me like $20 for groceries. And so if I don't bring enough groceries home with that $20, then he usually beats me or something. And this time he strangled me. So I just want to make sure that I'm okay.
Tell me a little bit more about the strangulation part. Can you describe kind of what that experience was like for you?
We were standing up in the living room, and he started to strangle me, and I was standing up, and then I lose consciousness, and I wake up on the ground. I don't know how long
Okay.
that was for, so I want to make sure I'm okay.
Okay. And I'm so glad that you're here. You are correct. You do need to be here. We need to make sure that your brain's okay. We need to make sure the vessels in your neck are okay. And we'll have some very specific instructions for you to kind of watch for injuries over the next couple of days. Because some of these injuries, you know, you don't necessarily notice the pain and that sort of thing for a couple of days, and swelling and that sort of thing that we'll have you watch for. So, there's some other things that we can do to help you while we're assessing your neck and your head and everything for the strangulation. We can also document, you know, what your experience was like, what other kinds of injuries that you've experienced. I just want you to know that anything that you do tell me for the forensic record would be separate and apart from your medical record and will not be released to anyone. Unless there is a signature from you saying that you want it released. Typically, you know, if you wanted to notify law enforcement, we could get them involved. If you don't, that's okay too. That's not a determining factor, you know. So the idea is we want to make sure you're medically okay, and then we can do the documentation for you. We can take photographs of your injuries if you would like, and all of that can be held for you in case you ever do want to go forward and have him held accountable legally for his actions against you, because the way that he's been treating you is not right. You have a right to live in an environment where you are not hurt. You have a right to be safe in your environment. You have a right to be treated with respect. And I'm sorry that this happened. And I just want to make sure you get what you need to heal and recover whatever that happens to look like. And if it helps you to know that there's some documentation of what's occurred, then I can certainly help you with that. If you don't want to do photos, we don't have to do photos. This is about you and what you feel like would be most helpful right now. We also have an agency that's on their way out to see you, that they have all kinds of services available for you, whether it's free legal advice, or if you would like some counseling, if you would like someone to work with you and your children, if you would like some assistance in kind of knowing what kinds of things to get together for safety planning, especially since he controls a lot of the money. If you're needing some assistance with that, they can help with those kinds of things too. And so they're already on their way to kind of go over some services that they have available. But just know that we'll have the doctor come in and see you, and I'll put an IV in your arm so that we can put some contrast through and check out your vessels in your neck to make sure that you're safe and that your body's okay. All right. All right. I want to thank you so much for trusting me with your experience, and I mean to honor you with everything that we do here.